Hello and welcome to today's session. Today we shall be looking at the pharmacological questions that were asked during the period January to April 2025. Here is the first question. A client is ordered prednisolone daily. Which statement best explains why the nurse should instruct the client to take this drug in the morning? Why should the client take this drug in the morning? Morning administration of prednisolone will mimic the body's natural corticosteroid secretion pattern. Remember, corticosteroids will rise in the morning up to around 11 before they start going down. So that is going to be mimicked when you administer this drug early in the morning, right? Early in the morning, prednisolone administration mimics the circadian rhythm of natural corticosteroid secretion, that is higher in the morning and lower in the evening. Although establishing a regular medication routine helps prevent missing a dose, isn't the reason for taking prednisone in the morning. The half-life of prednisone does not depend on the entire time of administration. The client should take prednisone with milk or food to minimize GI upset. A client has been taking imipramine for depression for 2 days. The client's sibling asked the nurse, "Why is my sibling still so depressed?" Which response by the nurse is the most appropriate? Yes, it takes about 2 to 4 weeks for the drug to reach its full effect. The nurse needs to inform the client's siblings that it takes about 2 to 4 weeks before a full clinical effect occurs with the drug. The nurse should let the sibling know that the client will gradually get better and symptoms of depression will improve with time. Telling the sibling that the client is experiencing very severe depression does not give them important information about the medication. Additionally, this statement may cause alarm and anxiety. Conveying the sibling's concern to the healthcare provider does not provide the sibling with the necessary information about the client's medication. And finally, telling the sibling that the client's medication may need to be changed is inappropriate because a full effect will occur after 2 to 4 weeks. A healthcare provider prescribes gentamicin sulfate for a client with peritonitis. The client has pre-existing impaired vision and hearing. What should the nurse do? As a nurse, you need to question the prescription because gentamicin will cause further hearing impairment. As you know, aminoglycoside antibiotics, of which gentamicin is one of them, usually cause damage to the eighth cranial nerve and can result in ototoxicity. So if the client is already hearing impaired, the nurse should question the prescription with the healthcare provider who may determine that prescribing another antibiotic will be safer. Gentamicin is an appropriate antibiotic for gram-negative infections such as peritonitis. Gentamicin does not cause visual impairment. A client comes to the emergency department reporting of sudden onset of diarrhea, anorexia, malaise, cough, headache, and recurrent chills. Based on the client history and physical findings, the healthcare provider suspects Legionnaire's disease. While awaiting diagnostic test results, the client is admitted to the facility and started on antibiotic therapy. What is the drug of choice for treating Legionnaire's disease? Legionnaire's disease is azithromycin, guys, macrolide. Azithromycin is the drug of choice for treating Legionnaire's disease. Rifampicin will be used to treat TB. Amantadine is an antiviral agent, and amphotericin B is an antifungal agent, and they will be ineffective against Legionnaire's disease, which is caused by bacterial infection. A healthcare provider orders metoprolol and oxypronaline by a metered dose inhalation 4 times daily for a client with acute bronchitis. Which statement by the client indicates effective teaching about this medication? I need to hold my breath as long as possible before I can take a deep inhalation. The client demonstrates effective teaching if they state that they will hold their breath for as long as possible after inhaling the drug. Holding the breath increases the absorption of the drug into the alveoli. Metoprolol needs to be used over an extended period of for maximum effect. The client shouldn't use the inhaler whenever they feel out of breath because dependency can develop if disease is used excessively. The client should adhere to the prescribed dosage. Tachycardia is an expected adverse reaction to metoprolol. The client should be taught how to monitor their heart rate and contact the healthcare provider only if the heart rate exceeds 130 beats per minute. A healthcare provider determines that a client has been exposed to someone with tuberculosis. The nurse expects that the healthcare provider to order which treatment. Exposed to TB, you take daily dosage of isoniazid, that is 300 milligrams for 6 months to 2 years. All clients exposed to persons with tuberculosis should receive prophylactic isoniazid in daily dosages of 300 milligrams for 6 months to 1 year to avoid the deleterious effects of the latent mycobacteria. Daily oral dosages of isoniazid at rifampicin for 6 months to 2 years are appropriate for the client with active tuberculosis. Isolation for 2 to 4 weeks is warranted for a client with active tuberculosis. The nurse is preparing a teaching plan about increased exercise for a female client who is receiving long-term corticosteroid therapy. Which type of exercise is the most appropriate for this client? Looking at nurse A up to nurse D is the most appropriate one. Just walking. The best exercise for female clients who are on long-term corticosteroid therapy is a low-impact weight-bearing exercise. It could be walking or some slight weight lifting. Floor exercises do not provide for weight bearing. Stretching is appropriate but does not offer sufficient weight bearing. Running provides for weight bearing, but it's hard on the joints and may cause bleeding. A client is asking about dietary modifications to counteract the long-term effects of prednisone. What is the most appropriate information for the nurse to give to this client? Nurse A up to D. Based on the side effects of this prednisone, you need to increase your intake of calcium and vitamin D. Problems associated with long-term corticosteroid therapy include sodium retention, osteoporosis, and hyperglycemia. So an increase in calcium and vitamin D is needed to prevent bone deterioration. Dietary modifications need to reduce sodium, maintain high protein levels for tissue repair, and reduce carbohydrates, as there is a tendency towards hyperglycemia. Increased intake of complex carbohydrates is not indicated because of hyperglycemia. There should be decreased fat intake because there is a tendency for the central fat deposition. A primigravid client who was successfully treated for preterm labor at 36 weeks of gestation had a history of mild hyperthyroidism before becoming pregnant. Which instruction should the nurse include in the plan of care? Hyperthyroidism. You need to continue taking low dose of oral propylthiouracil as prescribed. Although thiamides such as propylthiouracil or methimazole are considered teratogenic to a fetus and can lead to congenital hyperthyroidism, that's goiter in the neonate, they still represent the treatment of choice. The gland should be regulated on the lowest possible dose. Hyperthyroidism is associated with preterm labor and low birth weight infant. So the client should contact the healthcare provider if contractions begin again. The client should not be urged to breastfeed because medications such as propionate and methimazole are secreted in breast milk. Tachycardia and not bradycardia is associated with thyroid storm, a medical emergency, and should be reported to the healthcare provider. A client is taking risperidone to treat positive and negative symptoms of schizophrenia, improvement of which negative symptoms indicate the drug is effective. Negative symptoms are social behavior and anergia. Remember, bizarre behavior, hallucinations, delusions, abnormal thought, all those are positive behaviors. So negative symptoms include asocial behavior, anergia, alogia, affective flattening are some of the negative symptoms of schizophrenia that might improve with risperidone therapy. Abnormal thought, as we have said, together with bizarre behavior, hallucination, delusions are all positive symptoms of schizophrenia. A client is receiving outpatient treatment for depression and suicidal ideation. What is the correct amount of imipramine to have at one time? Alright, looking at this one, I'll pick the lowest. This one is a 7-day supply. Because the client has a history of recurring depression and suicidal ideation, the nurse will give the client a 7-day supply of imipramine to prevent possible overdose. Giving client a 14, a 21, or a 30-day supply of medications will provide the client with enough medication to complete a suicide attempt. Tricyclic antidepressants are associated with a higher rate of death than selective serotonin reuptake inhibitors. Which medication will the nurse administer to a client who is experiencing a thrombotic stroke 2 days ago? Thrombotic. Looking at all the options, we take aspirin. Aspirin interferes with platelet aggregation to prevent, so it will help prevent blood clots from forming or growing larger, and aspirin is used in the treatment and secondary prevention of ischemic stroke due to thrombosis. Antiplatelet medication such as aspirin should be given by day 2 in the absence of a bleeding complication. Ateleptase, this one is a potent medication that breaks down blood clot. It is approved by the United States Food and Drug Administration, the FDA, for treatment within 3 hours of the onset of ischemic stroke. In this case, we are more than 48 hours, so that's why we will not be able to use it. So when ateleptase is given, the client should have at least a brain scan 24 hours post-infusion and prior to initiate the prior to the initiation of antiplatelet therapy. Methylprednisolone is a steroid with mild anticoagulant properties and is not indicated for acute stroke. The nurse teaches the client with anxiety about the appropriate use of lorazepam, which statement indicates that the client understands the client's teaching. Lorazepam, my medication isn't for everyday stress of life. The statement indicates an accurate understanding of the nurse teaching about the use of lorazepam. Anti-anxiety agents like benzodiazepine are used to treat anxiety that is unmanageable by other means beyond the client's ability to cope. For drug to be effective, it must be taken as prescribed. Lorazepam can cause physical and psychological dependency. Tolerance can occur, and doubling up the dose of lorazepam may increase the risk for tolerance. Lorazepam is a central nervous system depressant. When it is taken in combination with the alcohol, depressant effect increases, posing a danger to the client. A client who has started therapy for drug-resistant tuberculosis demonstrates understanding of tuberculosis transmission by saying, I'll stop being contagious when I have a negative acid fast bacilli test, right? Gland with drug-resistant tuberculosis is not contagious when the gland has a negative acid-fast test. Gland with non-resistant tuberculosis is no longer considered contagious when there is a clinical evidence of decreased infection, such as significantly decreased coughing and fewer organisms on sputum smears. The medication may not produce a negative acid-fast test result for several days. The gland will not have a clear chest X-ray for several months after starting treatment. Night sweats are a sign of tuberculosis, but they do not indicate whether the gland is contagious or not. After the nurse teaches the parent of an 18-month-old child being discharged with a prescription for cotrimoxazole about the medication, which statement by the parent will indicate the need for additional teaching. Wrong statement, guys. This medication must be given on an empty stomach. So when you prescribe cotrimoxazole, it can be taken on an empty stomach, but it can also be given with food or milk if it is causing an upset stomach. So monitoring the gland's urinary output by observing the gland's diapers is important because diminished renal function is a possible adverse effect of this drug. The child needs to be monitored for Stevens-Johnson syndrome and a possible and a serious adverse effect that can cause a sunburn type rash here. If it develops, the medication should be withheld and the healthcare provider needs to be notified. Drinking extra fluid is also essential to promote adequate renal function for a child receiving any sulfur type antibiotic. A nurse is caring for a client. The nurse believes the client has been abusing opiates. Which assessment findings would the nurse document as evidence supporting recent opiate use? Alright, opioid use. Euphoria and constricted pupils. Right. Opioids normally result in meiosis, that is pupil constriction, and so dilated pupils are not expected. Speech pattern is often slurred rather than rapid. Which comment from a client indicates a need for further instructions after being taught about taking ciprofloxacin? Ciprofloxacin, fluoroquinolone. I may get lightheaded from ciprofloxacin. You see, if the plants, while ciprofloxacin can cause some dizziness or other CNS effects, lightheadedness is not a typical or significant concern associated with this drug, and this may suggest a misunderstanding of the medication side effects. The client instructs a child's parents to administer the prescribed ferrous sulfate with citrus juice. The parent asks why they need to do this, which response by the nurse is the best. Nurse A up to nurse D. Citrus juice helps with absorption of ferrous sulfate because citrus fruit, that is, it contains vitamin C, which enhances absorption of ferrous sulfate elixir. Vitamin C is not needed for the production of red blood cells. Citrus juice may make the ferrous sulfate elixir taste better, but this is not the primary reason why we use. The child should drink the ferrous elixir using a straw to prevent staining of the teeth. A healthcare provider orders gentamicin sulfate 80 milligrams IV every 8 hours for a client with Pseudomonas aeruginosa. The nurse should infuse this drug over at least 30 minutes. the nurse should infuse gentamicin sulfate over at least 30 minutes. Remember, infusing the drug more rapidly might cause or increase the client's risk of adverse reaction, especially ototoxicity, just like in the same case when you're using Lasix, furosemide, you also approach the same way. A nurse has made a medication error. Which information is appropriate to include in the incidence report? The nurse has to indicate what he saw or what they saw and what they did. Only include what they saw and did, and that is objective data. The nurse does not try to interpret the likely cause of the incident, does not include statement from the clients about the incidents, or does not comment on the extenuating circumstances that led to the problem. Which combination of adverse effects should a nurse monitor for a client when administering IV insulin to a client with diabetic ketoacidosis? IV insulin. Hypokalemia, hypoglycemia. Blood glucose needs to be monitored in clients receiving IV insulin because the risk of hyperglycemia or hypoglycemia. Hypoglycemia might occur if too much insulin is administered. Hypokalemia, not hyper, might occur because IV insulin normally forces potassium into cells, thereby lowering the plasma level of potassium. Calcium and sodium aren't affected by IV insulin administration. A client with a manic episode is taking lithium. Which electrolyte level should the nurse check before administering this medication? Lithium, sodium. Lithium is chemically similar to sodium. So if sodium levels are reduced, such as from sweating or diuresis, lithium will be reabsorbed by the kidneys, increasing the risk of toxicity. Clients taking lithium should not restrict their intake of sodium and should drink adequate amounts of fluid each day. Calcium, fluoride, and potassium are important for normal body function, but sodium is much more important in the absorption of lithium. The healthcare provider orders 1,000 mils of D5 to be infused over 8 hours. The IV tubing delivers 15 drops per mil. The nurse should run the IV set at which rate? 1,000 over 8 hours. That should give you 31 drops per minute. How you do it? You take 1,000, you divide it by 8, you multiply by, so that will give you in hours. So you you also multiply it, you divide it by 60 minutes, then you multiply by 5. That should give you 31 drops per minute. A client is to take sulfamethoxazole, trimethoprim, Septrim for a UTI infection. Which statement indicates that the client knows how to correctly take this Septrin drug? I will need to get a urine culture when I'm finished taking the pills. After completing the drug therapy, it should be necessary to obtain a urine culture to accurately determine the effectiveness of the antibiotic. It is possible for symptoms to be relieved, but bacteria to remain still present in the urine. The client should complete the full course of the prescribed therapy and not stop taking the drug because symptoms have disappeared. The client should increase fluid intake, not decrease it, in order to dilute the urine and keep the urine tract flushed. If the client still has symptoms after taking all the prescribed pills, the client needs to return to the healthcare provider for follow-up. It is likely that another antibiotic needs to be prescribed as the organism may not have been sensitive to Septrin. The nurse is caring for a client prescribed a tocolytic agent. The nurse takes immediate action based on which assessment? Nurse A to nurse D. if the gland has bilateral crackles on lung auscultation. Tocolytics are normally used to stop labor contraction. The most common side effect associated with the use of this drug is pulmonary edema. Bilateral crackles on lung auscultation is a sign of pulmonary edema, and prompt action will be required. A serum glucose level of 170 milligrams per deciliter, that's equivalent to 9.4 millimoles, is elevated and should be reported, but it's not life-threatening. Tocolytics may cause tachycardia and increase cardiac output with bounding arterial pulsation. A peripheral pulse strength of +2 indicates a slightly lower than normal level that is not an immediate cause of action. The gland has prescribed lisinopril to treat hypertension. The nurse should assess the gland for which electrolyte imbalance, lisinopril. These are the angiotensin converting enzyme inhibitor, right? Hyperkalemia, lisinopril is an ACE inhibitor. Hyperkalemia can be a side effect of this drug. Because of this, the side effect, ACE inhibitors should not be administered with potassium-sparing diuretics like spironolactone. A client is admitted to the alcohol detoxification program. Ask the nurse if there is a medication to stop me from wanting a drink so badly. The nurse should teach the client about, yes, naltrexone, right? Naltrexone is a drug that can decrease alcohol's cravings. Remember, cloxorapazide and other sedatives will help reduce symptoms of alcohol withdrawal but don't decrease cravings. Haloperidol may be given to treat clients with psychosis, severe agitation, or delirium. Magnesium sulfate and other anticonvulsant medications are only administered to treat seizures if they occur during the withdrawal. Naltrexone. The nurse is teaching a client and the family about phenelzine. Which food should the nurse instruct the client to avoid? Remember the monoamine oxidase inhibitors. Yep. So we have the sour cream. Because phenelzine is a monoamine oxidase inhibitor, the client should avoid foods that have high tyramine to prevent the development of hypertensive crisis. Food and beverages high in tyramine include sour cream, aged cheese, yogurt, red wine, beer, bananas, avocado, salami, sausage, bologna, caffeinated drinks, and colas and chocolate. High protein foods that have undergone protein breakdown by aging, fermentation, pickling, or smoking should be avoided. Hypertensive crisis, evidenced by occipital headache, stiff neck, nausea and vomiting, sweating, nose bleeding, dilated pupils, tachycardia, and constricting chest pain can occur with this food-drug combination. Eggs, chicken, and peanut butter are not good food, foods high in tyramine and can be included in someone's diet. A healthcare provider orders triamcinolone and salmeterol for a client with a history of asthma. What action should the nurse take when administering this drug? Salmeterol is a SABA. Triamcinolone, this is an inhaled corticosteroid, I think. So you have to administer salmeterol and then administer triamcinolone. Client with asthma typically takes bronchodilators and uses corticosteroid inhalers to prevent acute episode. Triamcinolone is a corticosteroid and salmeterol is an adrenergic stimulant, bronchodilator. If the client is ordered a bronchodilator and another inhaled medication, the bronchodilator should be administered first to dilate the airways and to enhance the effectiveness of the second medication. The client may not choose the order in which these drugs are administered because they must be administered in a particular order. Monitoring the client's theophylline level isn't necessary before administering this drug because neither drug contains theophylline. A client with suspected myasthenia gravis is to undergo a test with hydrophonium. The client asks if hydrophonium can be used to treat myasthenia gravis. What is the nurse's best response? Hydrophonium drug used in myasthenia gravis. Hydrophonium has a very short half-life, and this makes it impractical for long life. Hydrophonium is not available in an oral form, and a duration of action is about 1 to 2 minutes. This makes it impractical for long-term management of myasthenia gravis. Immunosuppression with repeated use is an adverse effect of steroid administration and not hydrophonium drug. Dry mouth and abdominal cramps are adverse effects of increased acetylcholine in the parasympathetic nervous stimulation and therefore unrelated to hydrophonium drug. Which explanation will be the most appropriate when teaching a client about general anesthesia induction? General anesthesia induction, you will breathe in medication through the facial mask to make you sleepy. Children are induced for general anesthesia by giving them medications through a facial mask to make them sleepy. Children are not induced with an injection. Children usually are not induced by the use of facial mask with IV administration started while they are still awake. A client who is receiving chemotherapy expresses concern at the thought of losing hair on their head. What should the nurse tell the client? Your hair will be temporal, hair loss will be temporal. Would you like to tell me about your concern? Remember, alopecia, which can occur with administration of some chemotherapeutic agent, is psychologically disturbing for many clients, even though the loss is temporary. Clients should be reassured that their hair will grow back. The nurse should encourage the client to discuss any concerns and should explore various options available for the client, e.g. the caps, the wigs, the scarves, and the turbans. Telling the client not to worry about their hair loss or that there are more serious worries trivializes the client's concerns. Telling the client to learn to cope with the hair loss conveys negativity and harsh judgment and is likely to demoralize the client. After surgery, the client was treated for postoperative nausea and vomiting and is now experiencing hypotension and tachycardia. The nurse should review the medication record to determine if the client has received which medication. Yes, droperidol. Droperidol. Hypotension, tachycardia are common adverse effects of droperidol and should be monitored closely by the nurse. Hypotension and tachycardia are not common effects of ondansetron hydrochloride, the prochlorpromazine, and the promethazine. A nurse administered a neutral protamine hegemon, NPH insulin to a client with diabetes mellitus at 7 in the morning. At what time should the nurse expect the client to be at most risk for hyperglycemia? So this drug is normally the duration of about 12 hours. So by the end of 12 hours, the drug will be done, will not have the drug. So 19 there, no hypoglycemia. So about 4 hours, that should give us 11 m. 11 a.m. So that is 7 plus, okay, 3. So NPH is an intermediate insulin that has a peak between 8 to 12 hours. Because the drug is administered NPH at 7, so we could add 8. That gives us, the gland is at greatest risk for hyperglycemia from plus 8, that is 13, from 3 p.m. to 7 p.m. That is 3. All right. Okay. The antibiotic correctly matched with its side effect or adverse effect is which one? Yeah, ceftriaxone, penicillin allergy, azithromycin, we will think of Tosadis dipointes, ciprofloxacin, tendinopathy, and gentamicin ototoxicity. An antibiotic that has no effect on gram-negative, no effect on gram-negatives. Vancomycin. Vancomycin is a glycopeptide antibiotic. It inhibits cell wall synthesis, but it is only effective against gram-positive bacteria because it cannot penetrate the outer layer of a gram-negative bacteria. A patient who sustains tendon rupture is likely to be suffering from tendon rupture. Fluoroquinolones. Fluoroquinolones are strongly associated with tendinopathy and tendon rupture, especially the Achilles tendon. So the risk is higher in older adults, patients on corticosteroids, and those with renal insufficiency. Which of the following antimicrobial agent normally targets the RNA polymerase? RNA polymerase. It's the rifampicin. Rifampicin specifically targets the bacterial RNA polymerase, inhibiting the initiation of the RNA synthesis. It's commonly used to treat tuberculosis and other bacterial infection used by susceptible organisms. Which of the following is, what is the mechanism of action for tetracyclines? Tetracyclines. Inhibition of protein synthesis by binding to the 30S ribosomal unit. What is the drug of choice for syphilis? Syphilis is penicillin G. Alright guys, those are some of the MCQs that were tested during that period. Let's look at some of the short answer questions. Like the first one, you're talking of describing furosemide drug. You give the therapeutic pharmacological mode of action and side effects. Describe some of the side effects associated with corticosteroid medication use. State mode of action of any 4 types of insulin. Describe any 4 types of highly antiviral therapy used to treat AIDS. State 4 groups of beta-lactam antibiotics, giving examples in each case. Starting with the first one, furosemide. The therapeutic class is that this is a diuretic. It's a loop diuretic. And pharmacological class, this of course is a sulfonamide derivative, and it's a loop diuretic, right? The loop diuretic is the pharmacological class. The therapeutic is just a diuretic. Which means that it acts on loop of Henle in the kidneys to promote elimination of water and salt. Furosemide inhibits the reabsorption of sodium and chloride in the ascending loop of Henle, leading to an increase in urine output. This results in reduced blood volume, which helps in lowering blood pressure and reducing edema. Side effects of this drug, furosemide, it can cause hypokalemia, so you have low calcium, not calcium, but potassium levels. So you need to monitor the serum potassium levels and supplement with potassium or use a potassium sparing diuretic in combination. Hypotension, that is low BP, you need to monitor BP regularly, especially during initial dosages, adjust the dosages accordingly. It can also cause dehydration, so ensure adequate hydration for the patient and monitor fluid and electrolyte balance regularly. Ototoxicity, that's hearing loss, especially with high dosages. Avoid rapid administration and monitor for signs of hearing impairment. Remember this side effect, they share it with gentamicin, the aminoglycosides. Side effects associated with corticosteroid medication. Number one is have weight gain, and this is normally due to fluid retention and increased appetite. Number three, have hyperglycemia due to increased glucose production in the liver. Osteoporosis, these are it results from long-term use. This can lead to bone weakening. Increased risk of infection due to immunosuppressive effects of this drug. Peptic ulcer diseases or peptic ulcers. Corticosteroid use will increase the risk of gastric irritation. Mood changes can cause irritability, mood swings, or depression. Cushing syndrome, this one results from prolonged use and may lead to moon face, buffalo hump, and thin skin. Mode of action for any of the four types of insulin, we have rapid acting insulin. Example, we have insulin lispro or humalog. We have lispro, arginine, right, and glucagon. So they rapidly reduce blood glucose levels by promoting glucose uptake into cells, and they act within 15 minutes of administration, and they lasting for about 2 to 4 hours. Short acting insulin, example, you have regular insulin, Humulin R. So you will see R on the vial. They start acting within 30 minutes and it picks up in 2 to 3 hours, and it is going to last for a duration of about 6 to 8 hours. It helps control glucose after meals. That one is intermediate acting insulin. An example is the NPH insulin, Humulin N. It has an onset action of about 1 to 2 hours and then picks up in 4 to 12 hours. Then it lasts. The duration is about 12 to 18 hours, and this provides basal glucose control. Number 4, we have long-acting insulin like insulin glargine, the Lantus. It provides a steady release of insulin over 24 hours with no pronounced peak, helping to maintain baseline glucose levels. Lastly, we have inhaled insulin. Classes of highly antiviral drugs used to treat HIV. We have nucleoside reverse transcriptase inhibitors. Examples, you have zidovudine. These one, they inhibit reverse transcriptase by preventing the conversion of the viral RNA into the DNA. Non-nucleoside reverse transcriptase inhibitors. Example, we have efavirenz. They bind to reverse transcriptase, blocking the enzyme's activity. We have protease inhibitors. Example, we have lopinavir, ritonavir. These are they inhibit HIV protease, preventing viral maturation. Next, we have integrase strand transfer inhibitors. This one, they block the integration of the viral DNA into the host genome. Entry inhibitors or fusion inhibitors, we have examples, we have enfivatide. They prevent the fusion of the HIV with the host cell membrane. The CCR5 antagonist examples, we have the maraviroc, which blocks the CCR5 receptor on the T cells, preventing HIV entry. Post-attachment inhibitors, examples, we have ibalizumab. They prevent HIV from entering T cells by binding to the CD4 receptor. Lastly, we have pharmacokinetic enhancers. These are just boosters. An example, we have the ritonavir. This is used to enhance other protease inhibitors, so like you'll find it being combined with lopinavir. The mode of action is just to inhibit enzymes that metabolize the HIV drugs, enhancing the efficacy of the drugs. 4 groups of beta-lactam antibiotics with examples. Of course, we have penicillin examples. We have amoxicillin, which inhibit bacterial cell wall synthesis by binding to the penicillin binding proteins. Number 2, we have cephalosporins. Examples, we have ceftriaxone, which is similar to penicillins. Cephalosporins will inhibit the synthesis of bacterial cell wall. The third one is carbapenems. Examples, we have imipenem. Action, this one is a broad spectrum beta antibiotic that inhibits cell wall synthesis. Monobactams are is a bit different class among the 4. Of course, an example, you have the azithromycin. This one action, it inhibits bacterial cell wall synthesis, primarily effective against gram-negative bacteria, the monobactams. Alright guys, that marks the end of some of the short answer questions that were tested in that period. Let's look at some of the long answer. Describe nifedipine and then describe NFO adverse or side effects associated with the use of ibuprofen medication. State the mode of action by any of the 4 drugs used in management of tuberculosis. Describe any 4 classes of drugs used in management of fungal infections, and state 4 groups of drugs, groups of cancer drugs, giving examples in each case. So nifedipine, in therapeutic class, it is an antihypertensive and also anti-anginal agent. Pharmacological class, it is a calcium channel blocker, a dihydropyridine subclass. Nifedipine inhibits the influx of calcium ions through the voltage-gated channel, calcium channels in the vascular smooth muscles and the myocardial cells. This leads to relaxation of the blood vessel, reduce peripheral resistance, decrease BP, and also reduces myocardial oxygen demand, alleviating angina. Side effects associated with nifedipine include hypotension. You need to monitor blood pressure regularly, especially during a dose adjustment. Peripheral edema, you need to elevate the legs and consider diuretics if necessary. Headache, you need to encourage hydration and administer mild analgesics if needed. Flushing, you educate patients that this is transient and usually self-limiting. Adverse effect associated with ibuprofen, we have GI irritation like nausea, ulcers, bleeding. You encourage the patient to take the ibuprofen with the food or milk and consider using a proton pump inhibitors such as omeprazole if long-term use is required. Renal impairment, you need to monitor kidney functions, especially in patients with pre-existing condition. Increased risk of cardiovascular events, you use the lowest effective dose for the shortest duration. Hypersensitivity reaction like rash, anaphylaxis, so you have to avoid in patients with non-NSAID allergies. For hepatotoxicity, the nurse needs to monitor liver enzymes during prolonged therapy. While tinnitus, the nurse needs to reduce the dose if symptoms appear. For edema, the nurse needs to avoid the use of ibuprofen in patients with congestive heart failure or significant fluid retention. Mode of action of 6 drugs used to manage tuberculosis. You could talk of the isoniazid, which works by inhibiting mycolic acid synthesis essential for bacterial cell wall. Or number 2, talk about rifampicin, which inhibits bacterial RNA polymerase, blocking RNA synthesis. Pyrazinamide disrupts bacterial membrane energy production and lowers intracellular pH. Ethambutol, which inhibits arabisobol transferase, disrupting myobacterial cell wall synthesis. Streptomycin inhibit protein synthesis by binding to the 30S ribosomal subunit. And then we have the bendaquilin, which inhibits ATP synthase, interfering with bacterial cell energy production. 6 classes of drugs used to manage fungal infection. You could talk of azoles like fluconazole, itraconazole, which inhibit ergosterol synthesis, disrupting fungal cell membrane. Or talk of pollines. Pollines include amphotericin B, nystatin. This one they bind to ergosterol and will create pores in the fungal membrane, causing death, causing the cell death. Echinocandins examples include caspofungin and micafungin. This one they inhibit beta-glucagon synthesis, weakening the fungal cell wall. We have allylalamines. They include terbinafine and naftifine. They inhibit succulin exportase, blocking ergosterol synthesis. We also have pyrimidine analogs like the fluticasone. This one inhibit fungal DNA and RNA synthesis. And lastly, grisofolvin. Disrupts microtubule function, inhibiting fungal mitosis. 7 groups of cancer drugs. We could start with alkylating agents like cyclophosphamide, cisplatin. This one they bind to DNA and cause cross-linking and preventing replication. We also have antimetabolites like methotrexate, 5-fluorouracil. This one they inhibit DNA and RNA synthesis by mimicking normal cellular metabolites. Antitumor antibiotics like doxorubicin, bleomycin, they interfere with DNA replication by binding to DNA and generating free radicals. Plant alkaloids like vincristine, paclitaxel, they inhibit microtubule function, preventing cell division. Hormonal agents, example, we have tamoxifen, anastrozole. This one, they block hormone receptors and inhibit hormone synthesis in hormone-dependent cancer. Targeted therapy, e.g. trastuzumab and imatinib. This one, they block specific molecular pathways involved in cancer growth. Lastly, we have immune checkpoints. Immune checkpoint inhibitors like the pembrolizumab and nivolumab, they block immune checkpoints, enhancing the immune system to ability to attack cancer. You are supposed to describe 10 mechanisms of antibacterial resistance, indicating relevant examples. Explain the RAS system in control of BP and associated drugs employed in the management of hypertension. You also explain extrapyramidal side effects and explain 8 classes of oral hypoglycemics. So 10 mechanism of bacterial resistance, we have production of enzymes that inactivate antibiotics like the beta-lactamases. With the notable examples of bacteria that can do this, we have Escherichia coli, which normally produces extended spectrum beta-lactamases. Modification of antibacterial target sites, like you can have what happens in the Streptococcus pneumoniae, how they try to evade the macrolides. They alter the binding sites on the bacterial ribosomes or enzymes to prevent antibiotic binding. Development of efflux pump. So bacteria will use this efflux pump to expel antibiotics out of the cell, reducing intracellular drug concentration. This normally happens in bacteria like Pseudomonas aeruginosa to resist fluoroquinolones. Decreased membrane permeability. So we have bacteria like Klebsiella pneumoniae, which normally causes reduced permeability to carbapenems. So by simply altering or losing of the porins in the bacterial outer cell membrane, and this reduces antibiotic entry. We can also bypass pathways like resistance to sulfonamides via overproduction of the dihydrofolate reductase. We can also have the target overproduction, like for the example, overproduction of penicillin binding proteins in methicillin resistant Staphylococcus aureus. Biofilm formation, for example, the Staphylococcus epidermidis in catheter-associated infections normally do this. We also have horizontal gene transfer, like transfer of the NDM1 gene, that is the new Delhi metallo-beta latase, this one conferring carbapenems resistance. The others, we also have mutations in the gene leading to fluoroquinolone resistance, and also have aminoglycoside modifying enzymes inactivating gentamicin and tobramycin. For the for the RAS system is a hormone cascade responsible for regulating BP and fluid balance. So when the BP or fluid levels drop, RAS is activated to restore homeostasis. So renin release is triggered by decreased renal perfusion, low sodium levels, or sympathetic stimulation. Renin secreted by the juxtaglomerular apparatus cells in the kidney converts angiotensinogen produced by the liver into angiotensin 1. Conversion of angiotensin 1 to angiotensin 2 happens when there is angiotensin converting enzyme produced primarily in the lungs. And we have several effects associated with angiotensin 2. We have vasoconstriction, where there is increased systemic vascular resistance, raising the BP. Also, it stimulates the adrenal cortex to release aldosterone by the zona glomerulosa, promoting sodium and water reabsorption in the kidneys. It also stimulates ADH release from the pituitary gland, increasing water reabsorption. So this will help restore blood pressure, increase blood volume, vascular resistance, resulting into elevated blood pressure. In terms of drugs that target the RAS system, we have renin inhibitors. Example, we have alscarin, which inhibits renin, preventing the conversion of angiotensinogen produced from the liver to angiotensin 1. We also have ACE inhibitors. Examples, we have enalapril, lisinopril. They inhibit angiotensin converting enzyme, reducing the production of angiotensin 2 and preventing vasoconstriction and aldosterone secretion. Group number 3 of drugs, we have angiotensin 2 receptor blockers, that is the ARB, the statins. Examples, we have losartan, valsartan. This one, they block angiotensin 2 receptors, preventing the effects of BP or aldosterone release. Number 4, we have aldosterone antagonist. Examples, we have spironolactone and ipleronine. Of course, spironolactone is commonly referred to as aldactone. They block aldosterone receptors, reducing sodium and water reabsorption. We also have diuretics. Examples, we have thiazide diuretics. They're used alongside the RAS inhibitors to enhance fluid excretion and reduce BP. Classes of oral hypoglycemic drugs and examples. Oral hypoglycemic agents are medication used to manage type 2 DM by lowering the blood glucose level. So these drugs work through various mechanisms, either by increasing insulin sensitivity or enhancing insulin secretion or reducing glucose production. So the first one, we have sulfonylureas. Mechanism of action, they stimulate pancreatic cells to secrete more insulin. Examples, you have glimbeclamide and glimclazide. Side effect, hypoglycemia, weight gain, gastrointestinal disturbance. So you just need to do dose adjustment based on renal function and blood glucose monitoring. The second one is biguanides. So this primarily reduces hepatic glucose production, that is gluconeogenesis, and also improves insulin sensitivity. The drug here is metformin, which is normally the first line treatment. It's associated with lactic acidosis, although rare, gastrointestinal disorders like diarrhea and nausea. So you need to start with a low dose and gradually titrate and avoid in patients with renal impairment. Thiazolidines, they improve insulin sensitivity by acting on the peroxisome proliferator activated receptor gamma receptors. Examples, they are also referred to as the glitazone. So we have pioglitazone, rosiglitazone, side effect weight gain, fluid retention, and increased risk for heart failure. You need to monitor for signs of heart failure and use cautiously in patients with cardiovascular disease. Dipeptide peptidase 4, DPP4 inhibitors. This one they inhibit DPP4 enzyme, leading to prolonged action of incretin hormones like the GLP-1, which increases insulin secretion and reduce glucagon release. They are also referred to as the gliptins. So we have sitagliptin and linagliptin. They are associated with upper respiratory tract infection, headache, and gastrointestinal upset. So you need to monitor renal function as dose adjustments are needed in renal impairment. The SGLT2 inhibitors, they do inhibit the sodium glucose cotransporter 2 in the kidneys, leading to increased glucose secretions in urine. Examples, we have the empagliflozin and canalflozin. Side effects could cause urinary tract infection, dehydration, and diabetic ketoacidosis. So you ensure adequate hydration, monitor for signs of urinary tract infections or ketoacidosis. Next, we have alpha glucosidase inhibitors. They inhibit alpha glucosidase enzymes in the small intestines, hence delaying carbohydrate absorption and reducing postprandial glucose spikes. Example, you have acarbose and miglitol. They cause flatulence, diarrhea, and bloating. So you take this medication to reduce gastrointestinal discomfort. We have magnetides. Magnetides stimulates insulin secretion just like the sulfonylureas from the pancreatic cells, but with a more rapid onset and shorter duration than sulfonylureas. Examples, we have the ripaglinide, natelglinide, side effect hypoglycemia, weight gain. So you take the medication you take with the means to avoid hypoglycemia, especially if meals are missed or delayed. The others, we have the glucagon-like peptide 1 receptor agonists. They mimic the effects of GLP-1 to stimulate insulin secretion, inhibit glucagon release, and slow gastric emptying. Examples, we have the exenatide, which is injectable, and liraglutide, which is also injectable. Side effect, you have nausea, vomiting, and risk of pancreatitis. Start with a low dose and gradually increase to minimize gastrointestinal side effects. Last, you have extrapyramidal side effects. Extrapyramidal side effects are drug-induced movement disorders commonly seen in antipsychotic medication. They result from blockage of dopamine receptors, primarily in the basal ganglia. These effects can lead to significant discomfort and functional impairment for patients. So we have Parkinson's-like symptoms, akathisia, dystonia, tardive dyskinesia. So mitigation strategies include regular monitoring. You screen for these extrapyramidal side effects using standardized assessment, especially when starting or changing the antipsychotic. You reduce the dose of the offending antipsychotic or switching the medication to a lower extrapyramidal side effect profile. Use atypical antipsychotics. Medication like risperidone, quetiapine, and aripiprazole generally have a lower risk of extrapyramidal side effect. And lastly, ensure that patients understand the importance of the symptoms, understanding the symptoms of extrapyramidal side effects, and the importance of reporting the early sign to facilitate prompt treatment. So, ladies and gents, please go through those questions, and if you find them helpful, you could share with your classmates so that we are able to get more and interact with many of us nurses. Otherwise, thank you so much, nurses. Have a great day.